I'm Dr. Yolanda Cintron. Welcome to Go Natural Dentistry, a Dr. Yolie podcast. I believe that one of the most valuable gifts you can give yourself is health and vitality. Here we will be exploring the mouth from the inside out. Make optimum health part of your lifestyle, starting with your mouth.
All right, so I'm here with our patient, Stacey. Welcome, Stacey.
Thank you.
All right, so I just wanted to first ask you what initially motivated you to come to our office?
I'd actually read an article from my thermographer. I follow her on Facebook, and she was talking about how important going to biological dentists were, and actually had highlighted the importance of people who have had root canals and the health, the deterioration of people's health due to root canals. And knowing that I had a root canal in this tooth and I was having sensitivity, I knew I wanted to go see a biological dentist.
Right, so that was something that worried you, once you heard that. Okay, so tell us how you felt about, your smile and the state of your teeth and your dental health really in general before Dr. Cintron and her staff were able to treat you.
Overall, I feel fine about my teeth, but I did have that lingering concern about the root canal that I'd had, especially after, reading up on it and understanding the implications of having dead teeth in your mouth.
Right.
So that was my number one priority in coming to see her, was to make sure that I handled the extraction of that root canal tooth properly.
Correct. Okay, so you feel that besides that, your dental health, how did you feel that your dental health was, prior to our treatment?
I didn't know as much about my dental health prior to coming here, and she and her staff have been excellent in educating me about just your overall dental health, and really, especially in taking the really high resolution pictures and x-rays and really seeing underneath what's going on, was very eye-opening.
Right, and as you know now, that your dental health has everything to do with the rest of the health, of your body and things like that. So you definitely would say that you feel that your dental health, your level of awareness has been raised with our educational methods.
Definitely.
Great. That's great to hear. So what did you find special about, Dr. Cintron that helped you choose to make that commitment, for your transformation?
Just her overarching, her experience level in dealing with more holistic approach to dentistry and overall health in her patients. So, not only do people come in here for cleanings, but they're also getting educated about how important it is to their overall health that they take care of their teeth. I don't think that happens enough in general dentistry. I think that things get glossed over. If you don't floss, I don't think they take the time to explain to you or even showing you those high resolution images like you guys take. And taking the time to really explain it to people. Really, I think, opens people's eyes, and it certainly did with me, in understanding how important it is.
No, I definitely appreciate that feedback. That's great to hear. So, just in line with that question, is there anything in specific that you found special about the staff? Would you say?
Every time I come in here, I feel extremely welcomed. I feel any question or concern I have, whether it has to do with billing or my treatment plan or the finances associated with it, or with my general health, I feel like everything is always taken care of. My concerns are always validated and acknowledged, and I feel, I'm just very grateful to have found Dr. Cintron.
That's great to hear. Thank you so much for that. And what would you say is the impact that, the treatment that you had here had on your life and your health overall?
I don't think I even know what the full impact is, because, to be honest, I had an extremely terrible infection in my mouth that was in a front tooth that I didn't even really know was there. And so to know that was lingering in my body for 10 years and now it's gone, I have peace of mind that I've taken control of my overall health and that I can continue, because I'm very focused on my health in general, and I feel like this was a piece that might have been affecting me and I didn't even know it.
Right. So that awareness definitely is something that changed you for the better.
Definitely.
So I'm really glad to hear that. So last general question is, would you, recommend us to, your friends, family, coworkers, and things like that?
Absolutely. I think that for me, I wouldn't want anyone to suffer and not get an opportunity to come see a doctor like Dr. Cintron. Unfortunately, I think there is a standard in dentistry, so people don't really understand, you know, that it's not okay to not floss, but they don't it hasn't been emphasized enough.
Right.
So I think that if anybody has an opportunity to come and see her, I do understand that there is a lot of times more of an out-of-pocket expense, but it's well worth it. I mean, our health is, you can't put a price on that.
Absolutely.
And I think it's important to get control of the health in your mouth, especially because that impacts everything.
I absolutely agree. Thank you so much for that. And so just to get a little bit more specific with your case, doctor was telling me earlier and explaining to me that you had that badly infected root canal tooth in your upper anterior. Could you, tell me a little bit more about that, and when did you get this root canal done?
Yep. So I started noticing sensitivity and pain. It actually came out of nowhere about 10 years ago.
Wow. Okay.
I was a competitive horseback rider. I think I took a lot of falls. I have a feeling that could have contributed to just the infection, where it began and how it happened. Just a trauma. I had the tooth root canaled. I had a very good experience having that done. The doctor was very good and accomplished what I thought needed to be done.
Right.
At the time, I didn't know anything about the implications of root canals. So 10 years fast forward, I started having sensitivity in that area, and having read that article from my thermographer about root canals and some of the things to be concerned about, I really was paying attention to that pain, so I didn't let it go for very long. And that's when I reached out and started doing research on biological dentists to try to make sure I went to somebody who could tell me, without being so focused, like an endodontist just does root canals. So I knew I didn't want to go back to an endodontist. I needed to go to someone who could look at this as a bigger picture and help me take care of my issue.
Right. So, and that does happen to a lot of or most patients really that come see us in our office. They think that they're doing the right thing, and they're not really educated in general about, what could go wrong or really how that affects the overall body. So I'm glad that you were able to, get to the root of that, really. So, you realized that you started having these issues about like 10 years ago, you said, and just randomly, so out of nowhere, it just started emerging. And so because of that, everything else, followed. Right?
So essentially that infection that they tried to take care of with the root canal never went away. Right. Because they didn't take the actual infection out.
Correct.
They didn't take out all that material. So it basically healed a bit, and then after maybe a little bit of time, that infection just started brewing up again.
Absolutely.
And for 10 years, I mean, it's pretty horrifying to think.
Right. So fast forward to now, you got that treated and whatnot. So how do you feel when they showed you the photos after it was removed?
I mean, I felt relieved, and to see the pictures, that was another thing. It was really eye-opening to be able to follow the journey of what was going on while I was sedated and under, sitting there and having all this work done, to be able to go through and see all the photographs and actually walk through that whole experience with the doctor afterwards was pretty amazing.
Right. One thing is just being talked to and educated about it, and then another thing is going through that actual process and seeing that infection, and being able to see that visual really does impact you, to realize that was in your body really has that kind of effect on you. So, now onto the healing process. How do you think the healing process went so far?
I think it's great. I mean, yesterday I had another phase of my, I had a crown, the permanent crown put in. They took some x-rays of the area where the tooth was removed. That area is healing up. I mean, if I just actually looked at the before and after pictures, the x-rays with the staff to really look and see how much healing has taken place in such a short amount of time is pretty miraculous. I had a complete deficit of the bone in that area, and it's already really almost, there's so much improvement in 1 month. So to see where I'll be in 4 months is, I'll be anxious to see.
Right. All right, Stacey. Well, it's stories and journeys like yours that we really appreciate hearing, and we love, hearing your feedback and all our patients. So I really do appreciate your time. And, we love having you as our patients. So we really do just appreciate, all the time and effort that you've spent here with us. And we look forward to continuing our relationship. Okay. So we really appreciate you having here. Okay.
Thank you. Thanks so much for having me.
Thank you so much. All righty.
Thank you very much, and I hope you join us again I'm Dr. Yolanda Cintron, and you have been listening to Go Natural Dentistry, a Dr. Yolie podcast. Visit gonaturaldentistry.com for more information on biological dentistry and dryolie.com to subscribe for more updates on holistic health. Join me next time for another podcast. Thank you for listening.